welcome to Wave Support. I see you're struggling with refitting a patient from a Essentials multifocal gas perm lens into the Wave lenses. I see you're struggling on a bunch of different fronts. One is the fit, one is comfort, and one is the power. So let's talk for a moment here about your designs. If we look first of all here at your topographies, and I notice a little bit of both, you've got this kind of ring which is most likely warping the cornea. And so if you remember that Essentials multifocal is a back surface aspheric lens, and quite often those lenses will create a little corneal warping. So one of the problems you're probably having with this particular patient is you're using Wave to create a very accurate lens on a poor topography. So what I'd recommend, if you can do it, ideally what I like to do in these patients is have the patient stay out of their contacts for a couple of days. And ideally, in a perfect world, for a week or two, but that's never possible, as you know. So usually what I'll try to do is have the patient stay out of the lens maybe over the weekend, and then first things on Monday morning before they go to work, I'll have them sneak in the office, just get a fresh, clean topography. It may not be 100% recovered, but at least it's not as bad as pulling the lens off and getting this decentered, warped area from the prior lenses. Now, with that said, as you know, that's never very practical from a patient standpoint, and so I'll get you a little recommendation here in a little while. So if we look at this lens, the next thing, keeping in mind, usually if I'm refitting a patient in say a 9.2 diameter lens, I try to keep those changes down to no more than a half to 1 millimeter. So in this patient, I would probably go up to maybe about a 9.7 or 9.8 to start. I think you're going to probably have to do a little rehabbing of this cornea before you come up with a final lens. So what I did, if you're looking at the right lens, you mentioned you had some fitting issues. Before we get on to a fitting change, just want to make one comment about the power. I know you had quite notable over refractions in these patients. What I like to do sometimes, a couple things. This one I noticed you did a GSIM, and one thought is, remember you've got this topography where you've got this steep zone in the bottom part of the cornea, mainly from warping. If you go to GSIM, it's going to try to take that into its design, try to make a design adjustment in this lens, this meridian versus here, and right away you've got some bad data for this vertical meridian. So if you got a cornea this warped, initially I'd probably, until I get rid of the warping in the cornea, I might just as initial lens just go with a RSIM design. Try to go up a little bit on the size so that way I've got a kind of similar design, and then probably when I have the patient come in, try to get them to stay out of their lens at least overnight, if nothing else, to see if you can soften up some of this warping that you have in the cornea that might help you get a little bit better reading of the topography, so a little more accurate lens. If we talk about the power of the lens, a couple tricks you can use there. If you switch over to here to this RSIM, this will give you a simulated version of this right lens. And if I remember from your clinical support request, the original lens was about a 730 base curve, and you had a much higher power in that old lens. And if you look at the over refraction that you came up with, it's really not that far off from the original lenses. So you can see that this particular design, you're just a little under minused, and that would make sense with the over refraction. What I like to do with a lot of these patients, if I can, especially if I'm dealing with some unknowns, I try to use this little tool here in case you haven't used it yet, this trial lens data. What I'll do is try to put a known spherical lens on the patient, known spherical base curve and power, place on a lens and just over refract over that to see what I come up with. And it gives me a really good opportunity to plug that data in here, and that usually gets me closer to the final endpoint is a lot quicker than just using strictly refraction and topography. Just a little trick I think you'll find helpful. I find that quite often helpful in these corneas that are a little bit torn up from a prior lens or warped up, and I'm trying to cut from point A to point B accurately. So again, what I'll tend to do is have the patient come in on, say, Monday morning, get a fresh topography, throw a known spherical lens on the eye, get a quick over refraction over that, send them on their way, let them wear their lenses, their old lenses now while I'm designing their new lenses. And again, I know that's not always practical to do, but that's what I at least shoot for if I can. So let's talk about a couple lens options you can try. In the meantime, my guess is that you're anxious to try to get something accomplished for this patient. So I would probably go to more of a 9.7 or 9.8 diameter. That'll give you a little bit larger lens than what you've been wearing. I'd probably keep it in RSIM initially as sort of the thought of this being more of a rehab lens for you. And then again, this is a back surface aspheric design in the old Essentials lens. So what I'd probably do is if you just do it in a spherical design, I'll let Wave do a little calculation. You get a little bit of this look, but I would probably try to soften up some of those transitional zones by just putting a little bit of back surface, a spheric contour to that lens. And that'll give us a little more similar design to probably what they were wearing. And this gives you essentially, of course I plug in the overrefraction data here that you came up with. And now you've got a lens that's going to be very similar to what they've worn in the past, hopefully with a little bit better overall fit. Now keep in mind you've got a pretty small pupil and a pretty large anterior optical zone, so you're probably going to have a little trouble with the reading anyways in this lens, but I think until you get this corneal situation hashed out, you're not going to get great reading anyways because these lenses are going to decenter. So again, if we look at the other eye, same logic applies. You've got quite a bit of inferior, let me bring this topography up here, quite a bit of inferior warping here from this lens decentering upward. So you want to get this lens to center well. What you really need to do is get rid of this ridge on the cornea. If you can do that, what I did, at least in the interim, I made more of a spherical design. And if you look at the 744 minus 277, if you sort of try to correlate that to your prior lens, which was about a 730-ish, I believe, 725-ish with a lot more minus, you'll find that when you add your 275 overrefraction on top of this, you get pretty darn close to what they wore in their previous lenses. So again, I think you just are a little bit off on that overall power in this lens, and that's again where this little tri-lens data tool can be helpful for you. Again, so what I did in this patient, I left it RSIM for the moment. I think if you're doing freeform, freeform would be the logical choice for going over this lens. If this was really actually part of the cornea, which I doubt it, if this is really part of the cornea, then you would want to go to freeform because that's to kind of get that to match this area. But again, I think you're dealing with probably more of a warped cornea from prior lenses, and if you could reduce some of that warping, get it out of the equation, I think you have a much nicer design in this lens. And so my recommendation would be maybe if you can't get that patient out of the lens initially, go to a little smaller diameter, stay at the RSIM. They'll give you a slightly bigger design than what you had, adjust for the powers, and then when they come in, if you can, have them not wear the lens the night before so you even get a fresher topography, but hopefully that'll get you a lens that's a little more wearable. So with that, I wish you well. This is going to be a bit of a challenge for you. It might take a little hit and miss, trial and error on some of the designs until you get them back on track, but I wish you well, and have a great day. Thanks for contacting Wave Support.